Alright, mama bear, baby pig, baby boy pig. Adequate nutrition is good for your body to heal. You should eat foods high in fibers, which include bran, broccoli, cauliflower, and fruits to help your bowel movements become regular. Eat foods rich in calcium, which include dark, leafy green vegetables, yogurt, and milk. Drink plenty of water and non-sugary supplement juices every day to satisfy your thirst and maintain hydration. Avoid soft drinks, coffee, tea, and alcoholic beverages. Gradually increase your daily activities until you're back to your normal routine. Rest frequently, no lifting, pushing, or pulling for the first 2 to 6 weeks, or as instructed by your physician. Do not drive until you are released by your physician. Your breasts and nipples may have changed during pregnancy. Wearing a well-fitted, supportive bra during day and night may help be more comfortable as your body adjusts to these changes. Wear breast pads until your breasts stop leaking. Leaking may occur for several weeks to months. You may apply ice packs between feedings to ease discomfort. Your baby's mouth should form a tight seal when breastfeeding. The lip should be against the areola, not the nipple. If the baby is sucking incorrectly, slide a finger between your baby's lips and your breast to break the suction gently. Reposition and try again. You should nurse for as long as your baby wants, which is usually 10 to 30 minutes. At first, your newborn will probably want to nurse as many times in a 24-hour period, though not for a very long time. It is important for the health of your breasts to have your infant feed from both breasts every feeding. Good signs of nursing include hearing your baby swallow without a clicking sound, seeing a movement above the baby's ears, the ears may even wiggle, and not seeing dimples in your baby's cheeks. You and your baby should appear calm and relaxed during the feeding. You should feel gentle tugging at the nipple, but no pain for the first few minutes. If you do feel pain, it may mean that the baby is not positioned properly or that the tongue does not extend past the lower jaw. Remove the baby and try again. Wash your hands frequently as you are caring for yourself. To prevent infection, always wipe from front to back after going to the toilet so you can clean your bottom with warm tap water using the Perry bottle after you urinate or have a bowel movement. It is important that you change your pad frequently. Vaginal bleeding will decrease in amount and from bright red to pinkish to brown or a yellowish or cream color. Your menstrual period may occur as early as 6 weeks to 2 months after the birth of your baby. Avoid constipation. You may take a laxative or stool softener until bowel movements become regular again. Increase fluid and fiber in your diet. Discuss birth control options with your healthcare provider. You may choose to obtain a method of birth control before resuming sexual intercourse. Nothing should go into the vagina for the first 6 weeks after discharge. Sexual intercourse should be avoided until bleeding has stopped or until you feel ready physically and emotionally. The warning signs to report to your healthcare provider immediately are redness, pain, warmth, swelling, discharge, drainage, or foul-smelling discharge from the incision, or if the incision begins to open. Discharge from the vagina that has a bad odor, severe headaches, blurred vision or vision changes, a temperature above 100.4, or if you feel coldish and feverish. If you have thoughts of harming yourself or the baby, pain or burning sensation or swelling in the legs with redness and warmth, breasts that are painful, swollen, hot, tight, or itchy, or have sore spots with redness or red streaks, flu-like symptoms, sharp pains in your abdomen, breast, or chest, trouble breathing, dizziness or faintness, crying spells, mood swings that feel out of control, unable to empty your bladder, or urination that is painful, difficult, or too frequent, and difficulty having bowel movements. Please call the abuse hotline if you're experiencing domestic violence or abuse. Now the teaching for the infant. Place him on his back to sleep. Use sleep clothes such as a one-piece instead of a blanket. Do not let anyone smoke around your infant and use a firm mattress or a safety-approved crib covered by a fitted sheet. Car seats and other sitting devices are not recommended for routine sleep. Do not use pillows, blankets, or pillow-like bumpers in your infant's sleep area. Wedges and positioners should not be used. Keep soft objects, stuffed toys, and loose bedding out of the infant's sleep area. The baby should be kept in the same room as the parents, but not in the same bed. Avoid covering the infant's head or overheating. Keep the bulb syringe near the infant at all times to clear the infant's throat or nose if necessary. Clean the bulb syringe well with warm soap and water after each use. Allow to air dry. Wash your hands prior to handling the neonate. all infants are required by law to be in a car seat while the car is in motion. Children should be placed in a child safety seat according to the state law. The use of outdoor announcement is not recommended to announce the birth because they call attention to the presence of an infant in the home. Question any unfamiliar person visiting your home or inquiring about your baby after discharge. Do not use home monitors or commercial devices marketed to reduce the use of SIDS, the risk of SIDS. Crying is a normal response from your infant. The most likely causes are hunger, the need for a diaper change, or the need to burp. You should burp your baby after each feed. Calming techniques include feeding the infant, changing the diaper, gently rubbing the back or tummy, or walking with the infant. Rocking your infant skin-to-skin contact, or giving a pacifier. It's never okay to shake the infant. If you get frustrated or angry, put the infant in a safe place, take a break, and call a friend. Sleep patterns. Infants require a lot of sleep. You should be waking your baby at least every 3 to 4 hours for feeding, and you should place the baby on his tummy each day for supervised tummy time. This will strengthen his neck and abdomen. Your infant should breastfeed 8 to 10 times a day as he cues. Be sure to hold your infant close while breastfeeding. The infant needs to be cuddled and skin-to-skin time is recommended. After feeding, hold your infant upright over your shoulder while gently patting or rubbing his back to burp. It's normal for your infant to develop a rash on his skin. It appears with a small red circular area with a white dot in the middle. This does not require treatment and will generally resolve within the first few weeks. Avoid lotions, powders, and perfumed soaps. He may get pearly white bumps on his face, especially around his nose. They will disappear within the first few weeks of life. And jaundice is a common occurrence in newborns. Your infant may appear to have a yellow coloring on his skin. It'll start in the face and progress downward. If the infant appears to be more yellow in the next 24 hours, then call the healthcare provider immediately. Your infant will need to be sponge bathed until the umbilical cord falls off. Use a soft washcloth with plain water, gently washing the infant's face. Bathe the infant from head to toe, saving the diaper area for last. Mild infant type soap may be used on the infant's body. Keep the umbilical cord clean and dry. Cleanse with warm water and soap when soiled. Inspect the cord and surrounding skin with diaper changes, and notify the pediatrician if drainage or discoloration is noted. The umbilical cord will generally fall off within 2 weeks of life. 1 to 2 wet diapers are normal for the first day or 2 of life. Then you should expect to have 8 to 6 wet diapers of pale urine every day. Over the next few days, the infant's bowel movements will begin to change from a yellow-green to a mustard yellow and will soften in consistency. Your infant should have at least 1 bowel movement every 24 hours. You may want to keep a record of your infant's wet and dirty diapers to monitor adequate elimination and hydration. He's uncircumcised, so always wipe from front to back. Be sure to cleanse all creases and folds and prevent diaper rash, pat dry, and diaper. Dress your infant as you would yourself. Avoid overdressing. Too much clothing and too many blankets may cause your baby to become overheated. Infants should receive all recommended vaccines.